Welcome back. Now in this video, in continuation of basics of barium study, this is the part third, and in this video, we'll further go through the various concept of this role of barium studies, various types of barium studies in gastrointestinal tract. In this, the third part, basically we'll focus on the barium meal, then barium meal follow through. And this is this very important slide here, the spectrum of barium study. We have started the previous parts also with this spectrum, if you remember, and I'll advise to please go back through those part 1 and part 2 videos related to barium studies if you have not attended, and if you have already gone through those videos, very good. Now in this video we'll start with the barium meal part. Barium swallow we have already covered in part 2. Now, as you know, after barium swallow, and barium swallow site was from oral cavity up to the fundus of the stomach. Now this is the second important type of barium study, barium meal. What is this barium meal? Now here the site is from esophagus to proximal jejunum. In this barium study, we have taken into account the whole of the stomach as well as the duodenum, the first, second, third and fourth part, whole of the C loop, along with a part of proximal jejunum. So starting with the esophagus, then stomach, then duodenum, and a part of jejunum. This is the whole site that is being covered by the barium meal study. What are the prerequisite? Before going for a barium meal, the patient must be fasting at least for 8 to 12 hours. These are the pre-procedure preparation. So 8 to 12 hours of fasting is required. Ask the patient to avoid smoking, and if there is gastric outlet obstruction features are there that is present in the patient, beforehand we can put a Ryle's tube and just aspirate the content, if any, in the stomach before going with this study, barium meal. Okay. So what are the indications when we are supposed to order this barium meal investigation in any patient? Obviously, if a patient is suffering from or showing any of these symptoms like unexplained weight loss associated with epigastric pain, the anorexia, the loss of appetite, and dyspepsia, vomiting associated or feeling of vomiting, nausea off and on, and features of gastric outlet obstruction. If these are the symptoms, if these are present, the patient could be an ideal candidate for this type of study, barium meal. So dyspepsia, epigastric pain, anorexia with weight loss, obstruction with vomiting. We must know the contraindications also. I am just discussing only the important ones. If a patient is suffering from or we are having a suspicion of perforation in any patient, hollow viscous perforation. Perforation is especially related to either esophagus or stomach or duodenum or proximal jejunum, the site covered by this barium meal. Don't do it. So suspected perforation, it's a contraindication for barium meal study. And if the patient is having features suggestive of active upper GI bleed, active upper gastrointestinal bleed is there, don't go with this barium meal study. So these are the two important contraindications for barium meal study: suspected perforation and active upper GI bleed. Here you can see this one. The stomach part, this one. This antrum, the duodenum, the C loop, right? So again, one of the example of the amazing study, this barium meal. As I've already discussed in the previous videos, that any barium study may have three views. For example, that one, the mucosal relief view. I hope you all know that what is mucosal relief view. Then the single contrast view. This one is single contrast, and the double contrast view. So in single contrast, only barium is there. In double contrast, barium along with air, or to be more specific, CO2, right? Double contrast. This is single contrast. You can see the outline of the stomach as well as the duodenal cap and duodenal loop, C loop, and this is the double contrast. Here you can see the presence of air also and the barium also. Topographically, if we can just correlate it with this topographic picture, here you can see this barium meal. This is the fundus of the stomach. These are the vertebrae. Just follow my cursor, right? And this is the body of the stomach, followed by the antrum part of the stomach. This is the duodenal bulb, and this is C loop of duodenum, and behind it somewhere there is duodenojejunal junction, just by the side of this vertebral column on the left side. And it can be very well correlated with this topographic picture. This esophagus is coming here, then the fundus of the stomach, duodenal bulb is here, and this is the pylorus part, right? This one is pylorus part, and here is the C loop, and behind this there is duodenojejunal junction and attachment of ligament of Treats. Obviously this ligament of Treats is not visible over barium meal study, but the luminal portion of hollow viscous, yes, you can comment. Now over this barium meal, the gastric mucosa somewhat looks like this. You can see the longitudinal folds of mucosa in the fundus and body of the stomach. These are known as gastric rugae. Okay, this is the vertebral column, and this is the fundus and body part. This one here somewhere is antrum, and these are longitudinal folds. During a barium study, we can see these are gastric rugae. Okay, in atrophic gastritis, obviously these are not prominent. The gastric mucosa, how it looks like on this barium study is, we can see these fine reticular, like here and here, this one, a fine reticular network of barium coated grooves, and these grooves are easily visible in old age patients, elderly patients, and gastritis patients suffering from stomach mucosa inflammation. And these reticular network, these are absent in case of atrophic gastritis. Gastric mucosa is atrophied. And patients of atrophic gastritis, they are usually a sufferer of achlorhydria, no hydrochloric acid. Now, after this mucosal relief view on barium meal, it's a single contrast barium study. And what we are supposed to do in a single contrast barium study? 95% barium suspension is given to the patient, and the volume is around 30 to 40 ml under fluoroscopy. Fluoroscopy is always required during any barium study. The 30-40 ml volume is given. Table should be horizontal and right side up. It should be rotated twice. And whenever we want to go for mucosal coating films, it should be taken into consideration in supine position only for mucosal coating films in single contrast. In mucosal pattern, if we want to see the mucosa of body and antrum of stomach, use right anterior oblique view. Why right anterior oblique view? Because this antrum part of the stomach is usually situated more towards right side and situated anteriorly when compared to the fundus part. So right anterior oblique view. Whereas if we want to go for mucosal pattern in the fundus part of the stomach, the opposite one is to the left lateral or left anterior oblique view is required. The same reason, right? Fundus is situated slightly towards the left as compared to the antrum. Okay. Mucosal pattern visible view on barium study. Here we are taking up the site if we want to see the mucosa of the fundus or body or antrum or pylorus. In a sequential order, I'm just discussing fundus, body, antrum and pylorus of the stomach. In single contrast means only barium is being used as contrast. Fundal mucosa is visible in supine position. Mucosa of the body of the stomach more clearly visible in erect or prone position. Whereas the mucosa of the antrum and pylorus in single contrast easily visible on prone right side down. Prone position and right side of the body below or down in both the conditions for antrum as well as the pylorus mucosa. Whereas in double contrast, whenever we are using barium along with the air or effervescent granules are being used like ENO or other fruit salt, in that case, for fundal mucosa, erect position is required in double contrast, whereas in single contrast, supine position was required. For double contrast, for body, supine position is required, different from the single contrast requirement. And again, for antrum and pylorus mucosa in double contrast, supine position with right side up in both the condition. Whereas in the single contrast, prone just opposite to the supine and right side down. Right? This is the basic difference between a single contrast, double contrast positioning of the patient during mucosal pattern view or mucosal relief view in barium meal. Any problem, you can always write to me. If something is not clear, just again, after finishing this video, again just revise it. Right? It's still not clear, you can just comment in the comment box. I'll try to help it out. Now, this is one of the example again, the barium meal, the double contrast in supine position. You can see the arrows. fundus, the body, the antrum part. This is the duodenum part, the loop, and you can see the barium as well as the air, presence of air, the double contrast, the mucosal view, right? Here. And this is the vertebral column. Which part is going to be clearly visible in which position? I've taken this picture from the internet and it is clearly demonstrating, very clearly demonstrating, I must appreciate, that if we want to demonstrate the antrum and greater curvature of the stomach, like this, of any patient more clearly, the position of the patient should be like this, right anterior oblique. Why right anterior oblique? Because in this position, the right side, the antrum is there, anteriorly it is there, and the greater curvature will come into account. So right anterior oblique, and as we go from right anterior oblique from this side to this side, means from antrum or greater curvature towards the fundus, the position of the patient is going to be turned like this. Just follow this arrow. Rotation is being done. The right anterior oblique, then the supine, X-rays are coming from this side, then left anterior oblique, and this is left lateral tilted head up, almost 45 degree. And here is the thing which clearly demonstration is being done of these reasons, these parts of the stomach. In this first one, right anterior oblique image, this antrum and greater curvature clearly visualized. In supine position, antrum plus body is clearly visualized. In left anterior oblique position, lesser curvature, and in left lateral with head up tilted to 45 degree, the fundus is clearly visualized. So whichever part you are suspecting that there may be some lesions, these are the advised or recommended position. So barium meal, in sometimes, if we want to see the protuberant lesions and if we are suspecting the antral gastritis, severe antral gastritis, in these two cases, protuberant lesions means any neoplastic lesion that is projecting into the lumen of the stomach. In these cases, what we are supposed to do? We can press the anterior and posterior walls of the body and antrum of stomach against the spine, right? So these anterior and posterior walls, they are pressed against the spine if we are suspecting protuberant lesions and antral gastritis. And take this picture. So this is important, the compression against spine. Compression of what? Compression of stomach. Now if we want to see the duodenal cap, what is the condition of the duodenum? Here you can see the similar thing. The fundus is clearly visualized if the patient is standing like this, erect position. Due to gravity, this part is coming down, the fundus and all the stomach is visualized like this. And the duodenal caps, they can be visualized in both the conditions, the right anterior oblique and a steep left anterior oblique. And this is the usual picture on barium study. This is the view of showing double contrast view of a normal duodenal cap. This is the normal duodenal cap. Normal duodenum looks like this one on barium meal. And this is the duodenal C loop, right? Can you appreciate this C loop? Okay, yes. This is duodenal C loop. There is another term that is known as biphasic contrast study. This 60 to 100% in this biphasic contrast study, the 60 to 100% of low viscosity barium is given orally with effervescent along with the last few mouthfuls of barium. The substances which are producing the CO2, known as effervescent, we have already covered in the first video. These should be given, and these biphasic contrast study, they are very helpful even for mucosal pattern view as well as any protuberant lesions inside So this is very important. So just remember, biphasic contrast study means you will have to add effervescent also along with the barium. Somewhat similar to double contrast. The very important thing is this one, the endoscopy versus barium swallow or barium meal. Which one is superior? Actually, both are important and both are having a definite indication, but as far as diagnostic accuracy is concerned, the diagnostic accuracy of endoscopy is high, almost 100%. So whenever for diagnostic purpose, the tissue diagnosis is required, endoscopy is always preferable as compared to barium swallow or barium meal. But if we want to see the functional aspect of esophagus or stomach, means if we want to see the motility disorders, the peristaltic movement of these organs, obviously the barium swallow or barium meal is superior as compared to endoscopy. Okay, so diagnostic accuracy high in endoscopy, almost 100% reaching up, and diagnostic accuracy is low in barium swallow and barium meal. Second difference is the endoscopy is better for erosive lesions and early tumor detection. The endoscopy procedure is better, and this barium swallow and barium meal, this is better for functional aspect demonstration, that is peristalsis or motility disorders. In these cases, these barium studies are more useful. Whenever we want tissue diagnosis and we need a biopsy for that, obviously the endoscopy is the option that is available for us, right? So this was the basic points regarding the barium meal after barium swallow. Now the third very important component, this barium studies for small bowel. Okay, we have we have demonstrated any pathology in any patient that is there in the oral, the upper cavity, the pharynx or the esophagus, then the stomach and the duodenum we have covered. Now let's come to the small bowel. Small bowel is having three parts: duodenum, jejunum, and ileum. Slightly overlapping sort of thing. Very quickly, barium studies. What are the options available for barium studies for small bowel? We can have a short note also. So barium studies for small bowel, it includes after barium meal, the barium meal follow through, BMFT, then SBFT. SBFT is a small bowel follow through. Then third one is enteroclysis. Enteroclysis is known as small bowel enema. Then per-oral pneumocolon. Few indications are there for this per-oral pneumocolon. We'll come to this point also. And sometimes, if required, retrograde small bowel examination may be done. This is not frequently required, but yes, this is one option that is also available, retrograde small bowel examination. So 5 important things are there as far as the barium studies for small bowel is concerned: BMFT, SBFT, enteroclysis, per-oral pneumocolon, and retrograde small bowel examination, right? So this will continue in this next video. So in this video we have covered the barium meal as well as the various options available for small bowel barium study, right? So in the next video, see you there. Thank you.